Good day to all my listeners. Myself is Dr. Krishnakant Sharma. I am an interventional cardiologist based at Baroda, right now in a Tricolor hospital. I am an interventional cardiologist. I have an experience of more than 10,000 or 15,000 procedures of cardiac interventions like angiography, angioplasty, etc. I want to give you some updates on the hypertension. Hypertension is a high blood pressure. It is a silent killer, and according to World Health Organization, around 60-70% deaths are due to non-communicable or lifestyle disorder in which the hypertension is the topmost. Hypertension is remain unnoticed until you go for a health checkup. Once you go for a health checkup, you know your numbers of blood pressure of systolic, which is above blood pressure, and diastolic, which is the below blood pressure, and you come to know you have hypertension or not. But sometimes one reading is not sufficient. You have to check twice, or sometimes weekly, or sometimes you have to go for an ambulatory blood pressure monitoring, and you can diagnose you are having hypertension or not. But take it a serious note. High blood pressure, you have to check again at least after 30 minutes or so, and both hands. And once a borderline reading should be monitored regularly, either by ambulatory BP monitoring or by checking again and again. And once you diagnose, you have to take medications regularly. In India, due to urbanization and lifestyle changes, the hypertension prevalence is increasing day by day, and young people are involved in hypertension. Hypertension is a silent killer. It complicates the heart, brain, kidneys, and eyes mainly. It can lead to cardiovascular stroke, means brain stroke, means paralysis. It can lead to cardiovascular events like acute MI, heart attack, silent cardiomyopathies, and kidney damage over a period of time, and in eyes they can affect the retina. So once you have diagnosed the hypertension, you have to take regular medications. According to the International Society of Hypertension, they have released the practice guidelines, and they have prescribed a non-pharmacological and pharmacological treatment. In American Heart Association guidelines and American College of Cardiology guidelines, stage 1 hypertension is a risk factor for atherosclerotic cardiovascular diseases, and you have to start your non-pharmacological therapy, means the de-stress techniques, yoga, exercise, cardio exercise, diet modification. All these are, especially the DASH diet, which is the low sodium diet, high potassium diet, more vegetable fruits and all. These are the part of non-pharmacological treatment, and you have to control your blood pressure within 3 to 6 months. If not, you have to start pharmacological therapy. So pre-hypertensive stage and every stage of hypertensive should have non-pharmacological therapy followed by a pharmacological therapy if indicated according to your doctor, according to the choice of doctor, according to your individual need. So lowering the blood pressure, the systolic one, the above blood pressure should be 110 to 130, will reduces the cardiovascular events. And most of the studies are showing that controlling the blood pressure means no complication for a long term in the future. But that doesn't mean you don't get the complications. So regular health checkups are also mandatory. Most patients with hypertension require a lifelong medical therapy to achieve the blood pressure control. Once you are diagnosed, you can control your blood pressure and it can come down to the level where the drugs are not needed, but it should be supervised and observed over a period of time that you are not need a medication. So be careful. If your blood pressure is remaining borderline or lower side, you want to stop the medications. It is one in a low dose. You can consult your doctor and then try to do so. Otherwise, not. Otherwise, sometimes the BP shoot up and you will land up in acute complications like intracranial hemorrhage and a heart attack, and you will go in more trouble. So there are lots of medications like ARBs, means valsartan, telmisartan, olmesartan, amlodipine, beta blockers, and diuretics, chlorothiazide and thiazide type of diuretics, and lots of drugs are available for hypertension, which is suitable to you, that is individualized. And ARB and calcium channel blocker and diuretics are usually the first choice medications depending on the body type and body habitus and your comorbidities. So there is one HYGEA study represent the largest study that tested nighttime antihypertensive treatment. In this trial, the chronotherapy was associated with significant reduction in the endpoints, including deaths. The HYGEA chronotherapy trial tested with nighttime therapy in comparison to usual upon awakening hypertensive therapy expert a favorable cardiovascular reduction. So most of these AAC or ARB activities are moved in the night hours, so you can give the medications to the nighttime and you can have a better blood pressure control. Now drugs are also coming which control blood pressure smoothly over a 24 periods of time, like isilsartan and many more drugs. So this is all about the hypertension. So be careful, get a regular checkup, get a regular touch in with your doctor, and make your life healthy and more smooth. Thank you so much.